Hello, everyone. I'm Dr. Darsh Shah.
And I'm Dr. Altamash
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare.
Hey there, this is Dr. Erin Wiseman. I'm a fellow Doctor Podcast Network member, life coach, and mama 3. I kick butt, I take names, and I help other high-achieving people do the exact same. And today, I want to invite you over to my podcast, Dr. Me First. It's well over 300 episodes, and each one is filled with inspiration and advice from amazing guests. So grab your wife, your mom, your sister, your best friend, and come tune in as we explore what it means to be a woman in medicine and a woman in this world. Because this podcast is a dose of everything that I needed when I was burned out, exhausted, and ready to quit it all. At the end of the day, I do this to help you feel more connected to yourself and to connect with others. I love to end my show with a kick of encouragement, so here's my favorite tagline. Your life, your calling, your pulse matters. See you over at Dr. Me First.
Thank you, Erin. Those are some great words because your life and your pulse do matter. And in this world where stress is at an all-time high and so many things are competing for our attention, we need to make sure we're picking things that nourish us, not drain us. And so for myself and Darsh, exercise happens to be one of those activities. And in this episode, we are discussing all the lessons that we learned from our discussion with Diwesh. So please enjoy. All right, guys, welcome back to another episode of Lessons Learned with myself and Dr. Shah, coming off a fresh night shift.
Fresh, man. Super fresh.
Yeah, I guess good morning, good night. I hate nights, man. I've never, ever want to do nights. It's just miserable because I don't sleep well during the day.
These are my last 2 weeks ever of nights, at least in internal medicine. So no more admissions for internal medicine, and I am looking forward to it. Absolutely.
Yeah. Now, when you at Hershey for PM&R, you guys do overnight call or no?
Yeah, so we do weekend calls. And I think we do overnight, like during the week. I honestly have no idea.
Yeah. All right. Well, today, Darsh, we are talking, we're going to discuss the lessons that we learned from our recent discussion with Diwesh Poudyal, who's been my coach for a couple of years. So I've had the luxury of picking his brain and learning from him and of course, benefiting from him programming for me. But what were your key takeaways, man? What was one of the first things that you learned from him?
Yeah. So the first thing that, really took away was the fact that he said that none of it matters, right? Like none of the physical therapy matters unless that relationship can be formed with his patients, right? Like that's the only way you can influence people and modify their behavior and lifestyle is that if you have a good enough rapport with them where they understand the mechanisms, they listen to you, they understand the assessments, and they're willing to go along, the journey with you. And one of the best things I've heard like other doctors say is, listen, we're like on this ship together, but you're the captain and I'm just here to like navigate the seas a little bit with you. So, for me, I think that's just super important for any healthcare worker is forming that relationship so that we can influence change for the positive.
I love that actually, that metaphor right there. Is it a metaphor? Yeah, it's a metaphor. I'm always using you're the quarterback and people who don't know football are just like looking at me like what does that even mean? So but I feel like the ship and captain, that's more applicable to the general population who don't understand football. But I love that because it reminds me how privileged we are in this field of medicine as being physicians, right? What I mean by that is people come to us on that first visit and within 5 minutes you can ask them the deepest, darkest issues that they have, and they share that with you. They entrust you with that information, and no other profession in the world has that luxury, right? And so the art of coaching and what Diwesh was talking about, and Dan was talking about something similar, is, building that rapport in that first session. They're spending so much time doing that. And this is why they kind of give their cell phone information out. And it's just completely outside the normal model of, hey, if you don't let your guard down, it's going to be very hard for them as a coach, as a therapist, to, you know, direct your care and for you to actually benefit from it. So that was something that really stuck with me as well. And then it allows them to cater this extremely customized program to the person. And this is kind of what the issue with actually some of these group-based classes are, is because you have much more, you have a difficult time establishing a rapport, at least in the initial phases, right, with a person. And
Yeah.
I I don't know if we've ever specifically discussed this issue. Like I think you're not a huge fan of CrossFit, if I remember. Is that correct?
Yeah, yeah, I'm not.
Yeah. So I mean, I don't want to get too sidetracked here, but yeah, I think that it doesn't necessarily have to be CrossFit, but it could be Orange Theory, it could be something else. You know what I mean? All these things have classes have so much benefit, and they provide a lot of good. But at the same time, when you're in a group based setting, and any good coach and trainer will tell you, is that's one of the huge limitations. Obviously, there are benefits as well, cost being one of them. It's the huge one. And
Hmm.
being as someone who's been on the side of teaching both group based classes and also doing one on one training, I can tell you that the latter is much more preferable.
Oh,
So
absolutely.
yeah, I couldn't agree.
Mind Pump Media actually has an episode on this on their podcast about the negatives about group based training. And they go through a lot of kind of what you're saying, in terms of it's not personable. You can't be as vulnerable with your coach. Um, it's just you're not really using your strength and expertise, right?
Yeah,
You're just kind of going with whatever the instructor's telling you, which might be their expertise. And that
yeah,
actually kind of gets me to my second point here with Diwesh, which is interesting, when he was talking about how when they do their functional assessment, they're like doubling down on people's strengths, right? While they sure try to improve weaknesses, they're really trying to double down. And that's something I don't think we often hear, especially in the gym. You think of Arnold Schwarzenegger, where his legs were so skinny, at the young age of 16, and he used to wear shorts going to the gym, so he could keep himself, saying, okay, I need to work on my legs, I need to work on my legs more than anything. But we often forget that, this is kind of what Gary Vee says in the business model sense of like an entrepreneur, is you want to double down on your strengths.
I love that. Yeah, it's really empowering the people. And I think specifically what he had mentioned is, let's get people to do what they can do. Let's focus on that, right? Let's not
Hmm.
focus on what they can't do. In a sense, we are hamstrung by this because, people come to see us in the clinic, and I'm talking about us physicians, but really any healthcare provider. When they come, they're coming with a problem, right? And so when they come to a problem, they have pain or some limitation or dysfunctional mobility. We have to directly focus on what they can't do and try to work on their weaknesses. And I think that that's the crappy part. That's the whole disease-based model, right? Because
Yeah.
not many people go to the doctor when they're healthy, and we can be like, "Great job, keep doing what you're doing, and let's just see how we can optimize your health." Right? It's really about, okay, you are suffering and let me fix this.
Yeah.
I'm going to share another awesome case with you at a different time that we saw. It was a beautiful PM&R case yesterday. But
Hmm.
that also kind of, leads into the next point, is the importance of the warm up. I think this is something that has been talked about quite a bit in the fitness realm, and now even, transitioned into just a regular, just a healthcare field as well, that the warm up is super, super important. But specifically how to structure a warm up. What were your takeaways, and what did you learn about how to structure a warm up?
Yeah, I think the biggest thing I took away from that is this concept of, dynamic versus static stretching. So, as an athlete growing up, I went to a pretty good high school for sports, and our track and field coach was insane. And so he thought he knew exercise physio to the T. So he would strictly only have us do dynamic stretches because he said static stretches will reduce your power input. And I was a sprinter, so there was no static stretching involved at all until the very end. But our warm-ups would include, some sort of plyometrics, active range of motion. And to break it down for the audience who might not know static versus dynamic, the easiest way I can say this is that dynamic stretches are essentially, things like leg swings where you're taking your limb or your joints and you're going through a range of motion with it, and that's kind of giving the muscle a stretch. Versus static stretching would kind of be your standard, try to touch your toes, and so there's not really any movement besides just that once at the joint. But we now know, as Diwesh was saying, that you can do both in your warm ups, right? It's more about the parasympathetics versus sympathetics than it is about the black or the white, which is dynamic or static. And so I almost for the last 10-15 years of training for me, I've only been doing dynamic, and I slowly started getting away from that as I started to understand that, hey, static stretches are actually making me feel better and actually making me lift more with certain lifts. So that was something cool that he brought up.
Yeah, and what he also alluded to was that the newer research now also shows that if you do static stretching and after a certain amount of time, the whatever the negative effects from that, I mean, they're counteracted and they're null at that point. But to your what you just mentioned about if the individual feels better, that is such a powerful thing. I remember attending a conference a number of years back where still foam rolling was a relatively new thing, and there were some debates of whether or not foam rolling improves performance, and this is a extremely academic discussion, and
Yeah.
one of the individuals was up there talking about how they did this study, and foam rolling showed to have no benefit at all. And the argument was, okay, then why are we wasting time, right? Because again, time is extremely valuable when you're for Division 1 athletes, or really anybody nowadays. Time is extremely valuable. It's one of the most valuable resources we have. But what they didn't, and at the time maybe I was too shy or I didn't think about this, is we don't account for the fact that, one, almost every individual nowadays has some type of dysfunction, right? I
Hmm.
won't say injury or pathology, but dysfunction. Like, they're not moving. Movement quality isn't that great because of just our posture and daily activities, what we're doing. Secondly, if you feel better, you are going to be, it's going back to that guard down, that physiologically your body is going to be much more relaxed into getting into positions where you otherwise might be guarding, and not letting your body adapt to different stresses, which we're going to touch on in a second. But that whole concept of your body is much more in a much better position when you're in a parasympathetic state to make changes, to learn,
Hmm.
is something that really was my favorite thing in our discussion. Because a lot of times, like for me personally, when we're programming these mobility drills, these quote unquote prehab drills, like for instance, let's just take a specific example for musculoskeletal sports medicine. Something super, super, super common, arguably the most common, is patellofemoral pain syndrome, right? Most people who might be listening to this have heard of that term or went to the doctor and have this non-specific knee pain. And some people say it's a garbage term, and diagnosed with patellofemoral pain syndrome, right? And what do we say for that? We say you have to do strengthening of like the part of your inside of the quads, a little bit of the glute muscles on the outside, the hip abductors, and kind of retrain your body and how that patella, the kneecap, moves. Well, a really great exercise for that is something called terminal knee extensions, where you take a band, you put it on the back, and do that. A great place to put that would be in the warm up phase. And again, as I mentioned, you're retraining the kneecap. Well, if you're in a sympathetic state and you're in a fight flight, your body's not going to make a lot of changes. It's not going to, maybe those motor patterns aren't going to stick. So that's why it's so important to do that. He also mentioned you could do it towards the end of the workout, but I'm guilty of this myself. He programmed some of the ancillary stuff towards the end for myself, and sometimes, like 2 days ago, I didn't feel great, I skipped it.
Hmm.
you know
Yeah.
so so uh so we're in a world where, like you said, we're on to the next thing, and so people are going to be less likely to do it. But speaking of, so anything else on that you might have?
Yeah, no, I was gonna say, man, working out is very mental, right? Exercise is a mental sport. It's like any individual. It's like tennis for me, right? It's very mental. If you're on your game and you know you can make that shot, you're gonna make that shot, right? So if I'm gonna go in and deadlift with the L5S1, I'm good up to like 250. But once I go to 260, right, it's only 10 pounds more. I could probably do it. You have this mental block. I don't know if you've ever gone through that, right? With just like squats or whatever it might be. So, I definitely agree with you. If you feel good, if it makes you feel good, if it's that placebo effect, that foam rolling, whatever it might be, go for it, right? And to your point about sympathetic versus parasympathetic, I think it's so key, right? And if there's one thing people can take away is understanding what sympathetic and parasympathetic are, right? Just Google search HRV, whatever you have to do to understand it, and figure out the things that increase your sympathetic drive and increase your parasympathetic drive as well. And try to reach that balance. Try to figure out what you want to go in with, right? Diwesh talks about, when you're just starting out with working out, you really want to be in parasympathetics because, like you said, you can drive that change in your body and the patterns. And then eventually, once you're good enough, you can kind of just go straight into the sympathetic, get those bigger lifts in, train that central nervous system. But it's interesting, right? Because a lot of people do like crazy pre-workout before, or they think they need coffee right before the workout, right? And you're driving your sympathetics through that. But then you're trying to do these mobility drills, right? So it's kind of counteractive, in some sense. But just having that thought process, I think, for people and individuals to understand will help them just appreciate the process a little bit more. I think slow it down and really just have fun with it and enjoy it. I think, at least for us, because we're nerds about it. But
I love that. And it also reminds me, I think that one episode with Peter Thiel when he had Beth Lewis on, I forget exactly what they were talking about, but I remember her saying that, for some individuals in the warm up, they just come to her and her thought is, I just have them lay on the floor and breathe. Right.
Yeah.
And because they're so revved up throughout the day that they just need the time to kind of just shut it down a little bit, which is, again, that's the last thing you want to do prior to a workout where people are just like snorting stuff to get going.
Right.
But that's important. And I also heard, David Ote on in his new podcast talk about that with one of the other coaches, actually probably more than once. It's sometimes, depending on the individual, that's the first thing they do with a warm up. And deep breathing is something that I have to do the warm up too, because I'm always go, 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 go. So yeah, I mean, I agree. But speaking of injuries, patellofemoral pain, that kind of stuff, we won't necessarily talk about training modifications for injuries because we've touched on that before, and hopefully with a future guest we will as well. But obviously COVID has kind of shaken our world up tremendously. I mean, unfortunately, some people, I'm psychotic in a sense. I've turned my entire gym every single day into something, my apartment into a gym. But you had some of these challenges about when your gym was closed. It's luckily open now. So what'd you take away from modifications, and maybe just recap for the individuals who still might not be comfortable going back to the gym? How can they modify their training regimen to continue, training at home or just outside or whatever?
Yeah, absolutely. So I think first off, I want to say, for those listeners out there that may feel guilty, you shouldn't, because I was in the same boat where I made excuses for myself almost, going from training every day in the gym to when COVID restrictions came. And then I said, you know what, maybe I'll just use this time as a deload phase, and I won't really do many squats or burpees or anything like that. I'll just stretch and do mobility drills and things like that, which are all great dandy. But in the end, it's okay, well, sure, when am I going to start running outside? When am I actually going to start, getting this body weight workouts in? And for me, again, I'm very OCD in a way that I need the gym, I need the weights. But when that's not possible, you really need to look at yourself and say, all right, well, what else can I do, right? Because this is important. And what Dewesh touched on is a minimum effective dose, right? Which is actually a lot less than what we would think, right? A lot of people think, oh, well, in order for me to get gains, I probably have to go to the gym at least 3 to 4 times a week and do some, heavy lifting and that way. But he says, no, actually, you can probably get away with just two days a week of like strength training for 30 minutes and then 2 days a week of cardio, let's say, for also 30 minutes. And you'll still see an improvement. While your gains might not be, there in a month or two, it's still something, right? It's still moving. It's still, getting your body and that blood flow and the lymphatics and everything just kind of moving. And so any type of movement works, right? And we kind of split into two groups of people where, it's people who need data, right? And will buy a Whoop or an Apple Watch because they need something to track it. And if that's that type of person, that's completely fine, right? There's, as he says, there's nothing wrong with having your watch tell you, hey, get up and move. I think we all need that reminder. But then, there's also this camp trying to figure out, hey, what are some things that I can buy, right? We see people going, quote unquote, off the wall and getting like a wooden stick with gallons of water on either end and building their own bench press. But you don't have to go that far, right? You can easily just, whenever there's a commercial on, do some squats. If the weather is okay, go for a walk. That walk will turn into a jog. That jog will turn into a hike. See what other people are doing. But there's always a way to get moving. You just have to be honest with yourself, I think, is the biggest thing.
Yeah, I mean, that story about people buying I mean, that's intense. It seems like a lot more work. I think I would rather just find something on Marketplace and try to buy old equipment. That just seems, but I love it. It's creative. You know, when people come to us with a very common complaint called tennis elbow, most people have
Mhm.
heard that, experience that, know somebody who's had it. For rehab, tried and true method is, you know, we do these eccentrics where you basically slower and you have to strengthen the muscles, right? You know this.
Mhm.
We often, when people come to, we tell them to start super slow, like grab a can of beans, again, a can of soup or something like that. So I mean, they're typically like a pound or whatever, depending on how big cans that you're getting, but stuff like that. So one training modifications he talked about, people just put books in a backpack. Most people have a backpack laying around, most people have some books laying around or whatever. You could put anything, and so you can modify load, right, which is kind of weight. Another way you could modify load is by adding accommodating resistance. So for those who
Yeah.
don't know what that means, it's like adding bands or chains to it, right? Chains are probably a little bit harder to come by. Bands, super easy to get from
Mhm.
Amazon or really anywhere else, honestly. Actually, Dave and John Russin on their new podcast, the PPSC, Pain Free Performance Podcast, which is awesome. I recommend you guys go check that out. They had an episode all around accommodating resistance, which was super cool. They talked about how they program it and what that means and all that kind of stuff. Another thing that you could modify is volume, right? Which
Mhm.
is typically, I mean, load plays into volume intense, but also how many repetitions you do. So, you know, if today you know, if you don't have a lot of weight, maybe instead of doing 10 reps, you could do 20 reps or 30 reps, something like that. You have to be cautious of that as well, because, you know, there can be detriments at some point for these things. Frequency is another one, right? You can train more times throughout the week for squats, or rather than doing squats once a week, you could do it 2 or 3 times a week. So that's another one. Those are the easy ones. But some of the other ones, another one that he mentioned is called tempo, right?
Mhm.
And that's how slow you go down and how slow you come up. Manipulating that variable can make an exercise much more challenging. And then lastly, I'll say, I'm sure I'm missing some stuff, but these are some of the ones that came to the top of my mind, is like exercise selection. So we're using body weight squats, which is a bilateral movement, right? That means you're doing like split squats. Excuse me, not split, but like even.
Mhm.
But you could reduce the base of support, right? So you can do a split squat where you're kind of like in a lunge position, right? And now it's more unilateral loading or single leg stance loading. You can completely remove the back leg up, or you can elevate your back leg, or people have seen pistol squats and those kinds of, you know, so now you have a
Yeah.
tremendous balance and stability component as well. And that makes it also, you're putting all the load on one leg. So that makes it much more challenging. It's also quote unquote much more functional, if you will. So yeah, I mean,
Absolutely.
there's so many ways, and you can do that for the upper extremity as well. You know, right? Instead of doing push-ups with 2 hands, you can do single arm push-ups, and you can modify
Mhm.
all this stuff.
Yeah,
Not worth getting
angles, all
into
that,
how.
right?
Absolutely, absolutely. So there's so many ways to do it, and then, you know, again, but it all comes down to, you got to figure out where your starting point is, and then you
Mhm.
just add there. You don't jump. Like, again, if you haven't trained in a while, you don't just, the weather gets nice outside, it's 65 degrees, so I'm just going to go
Weekend
on,
warrior, right?
yeah, I'm gonna go on a 7 mile hike, because then you'll probably come see me in clinic, and I don't want. I mean, as much
And you
as
don't want
I like.
Altamash as your doctor. Kidding.
That's right. That's right. No, I mean, you know, I love meeting new people, but you know, I
Yeah,
want to meet you guys somewhere else. Hopefully, we train together, but not in the clinic. So yeah,
absolutely.
yeah. Anything else you got on that?
Dude, last thing here, if I may, because I think this is really important, is talking about squats. Because I've definitely been guilty about telling people not, earlier on, not having your knees over, or your knees over your toes. And I think a lot of people listening to this podcast probably still think that. Um, and so we need to demystify this myth that when you squat, it was always taught that your knee, you have to put the weight into your butt, back of your heels, and midfoot, and then not have your knees cross over your toes, right?
Hmm.
But now we know, as Diwesh talks about, that that's actually not healthy for some people. We know as individuals, we all have different femur lengths and hip range of motions, and our ball and socket joints work in different ways. And for me, it's so bad now that when I squat, excuse me, when I squat, it's almost impossible for me now to even move my knees over my toes, right? Like, I have terrible dorsiflexion. And sure, I've had a lot of ankle injuries from playing basketball and stuff, and that's something that I'm now training. But, for me, with an extension pattern in my back, I like, back squatting is probably not honestly the best thing for me at this point, and my back pain has really resolved in the last month, especially with the workout program you gave me. So I go to a lot of front squats. And with front squats, you need that dorsiflexion of that ankle, so that your knees can come over, and so you have proper leveling of that barbell, right, in terms of center of gravity. So I really just wanted to mention that. What are your thoughts on that?
Yeah, no.
Anything you need to add?
Two things you mentioned: dorsiflexion and extension. Just explain what that means. Both of those terms.
Sure. So dorsiflexion is, and with your ankle, it's kind of bringing it up, right? So as if you ever gone to the doctor's office and we try to test your muscle strength and ankle, we'll say, all right, push down on a gas pedal, right? So that's plantar flexion. And then the opposite
Mhm.
of that, bringing your ankles up, would be dorsiflexion. So when you do your squat, you'll see that angle where if your knees kind of track over your toes, you're getting more of an acute angle between your ankle and your knee. And so that'd be more dorsiflexion. Extension pattern of the back, right? So we can have extension or flexion. Extension is when you see this lordotic curve in your lower back. And to explain lordosis, it's kind of this concave curve in your back where, let's just say your belly would be sticking out and then your butt would be sticking out on the other end. And then flexion would be the opposite, where you'd kind of have a flatter back or more of a rounded back. So again, for me, I'm more extended, which I think is more the common pattern. And then my dorsiflexion is terrible because it's just that bad where my brain only knows how to squat back and not have my knees track over my toes at this point.
Yeah, I love that. No, yeah, you lose that ankle mobility if you don't train it, right? It's you use it or lose it type thing. But yeah, the extension pattern is, we used to say, it's kind of like the Donald Duck pelvis, kind of like,
Yes.
show that picture for most people. They can quickly Google it. It's
Yeah.
also like anterior pelvic tilt. Actually,
Mhm.
Alex King, who was on here not too long ago, talked about that lower
Mhm.
cross syndrome, and that makes you more susceptible. So the squatting past the knees, I'm guilty of it. I talked about it on our on the episode with Darsh. Jesus, man, it's like I haven't gotten sleep. You were
Yeah.
there, but also Diwesh. Um, there's there are too many.
D's, man.
Yeah, D's and sh ending, is just throwing me
It's
off my
true.
game. I apologize. With Darsh and Diwesh, that I might have messed up some kids at a young age, teaching them how to squat improperly. I think, obviously I didn't know better, and I was guilty of this, but I also wonder if some of it, I messed it up for myself. So I used to have a lot of issues with my knee at the time.
Mm.
My right knee's kind of been one of my first injuries, and so to compensate for that, everything was heavy back, back, back. A lot of box squats, a lot of hip dominant squat patterns. And over time, some of my recent injuries have been issues with my back, like he mentioned, which is one of the reasons I sought him out, and also issues with like femoroacetabular impingement or hip issues. And
Yeah.
so, it's interesting, and it's just me speculating here, like how much could have this been self-imposed just because we didn't know any better. And so the one thing though I just want to add on is something he talked about is, adapting to stress. And I'll give up my own personal anecdote is, because I had this idea that, for my knees, I shouldn't do this. Another thing that I wouldn't do is he programmed earlier on in our training, he programmed heels elevated front squats type stuff for me.
Mm.
And for those who don't know, sometimes people will see in the gym, you throw some 5-pound plates underneath your heels, and that allows you to compensate for the lack of dorsiflexion that you're
Yeah.
talking
Yeah.
about, because it kind of gives you this artificial ankle mobility. And I was like, whoa, this is not good. I shouldn't be doing this, right? Because I have quote unquote bad knees. And he was like, just trust me on this. It'll help. And, just because I told him, I was like, yo, this bothers my knees. And he was like, reduce the load and allow your body to adapt to it. And now this goes back to our very first point, bringing it full circle. Because I trusted him as my coach and I trusted what he had to say, I allowed that to happen. And guess what, man?
Got
In a
better.
matter of
Yeah.
time, I was pushing super heavy loads, close to my previous maxes at certain reps, without any knee issues, and
Wow.
much more vertical posture and stuff like that. And that was so awesome for me. And at that point, like, and I was like, okay, I'm training with this guy, this is why I enjoy it, because I trust him. And a lot of times, like, I feel like I know some things going on, but I always like to bounce off of him because it gives me a new perspective. And obviously he does this 24/7, whereas I only dabble in it, and I have I have a strong understanding of it, and I'm always trying to learn from him. But it's the whole trust thing, and I let my body adapt to the stress of letting my knee go past my toes, or also getting into deeper knee flexion. And that's not my knee isn't going to be destroyed and stuff like that. Are there some times where it bothers me a little bit more? Sure. Yeah. And you just got to also be able to understand that. That's the other thing. I think people need to be able to appreciate what quote unquote discomfort is versus what true pain is. And at what point should you not let your body adapt to too much stress? Because I think we're also conditioned that pain is bad, pain is bad, pain is bad, and you must do everything to avoid pain at all times. But, this is why having a guide, as you mentioned earlier, is so important, who can tell you, okay, this is too much, this is not enough, blah, 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 that kind of stuff. So, that's the last thing I'll say. And I know you got to get to bed, so I'm going to.
Yeah, no, absolutely, man. It's a great episode. So definitely hope the listeners check out the full episode for this.
Yeah, I couldn't agree more. Well, before we let you go, and I think we just want to make a quick announcement, because we're going to change our format for how we're going to do these things. So why don't you tell the people of how we're going to switch after this episode, and why we're doing that.
Sure. So we're actually going to go to a 3+1 format. So what that means is, per month, we're going to give you 3 guests instead of our typical every other. So instead of getting 2 guests, you'll get 3 guests per month. And then in that last week, we'll be doing a lessons learned, but we're going to be recapping those 3 previous guests. And so just by doing this, we thought there'd be more value by giving you more guests, more value, more information. And then if for those of you guys that just love to listen to the lessons learned, you'll also get more content in that. And we'll try to also keep those around probably 45 minutes or so, 45 minutes to an hour, for those that like to listen to the shorter episodes. But yeah, that's going to be our new format moving forward. If you guys have any feedback though whatsoever, please let us know. We're open to kind of hearing it here. We're still pilot testing kind of this podcast. We're still new to the game, so we'd love to hear anything.
Yeah, and they can reach us via social, so quickly drop that. And then our email is medredefined@gmail.com. So again, we love to hear feedback and any suggestions that you guys might have. And, whether good, bad, or ugly, we consider it to be a gift. So let us know. All right, buddy. Get to sleep, man.
Take care. Will do.
Well, guys, that's a wrap on the show, and hopefully that was informative for you. Before we end, don't forget to go hang out with my friend Aaron Wiseman over at Dr. Me First on your favorite podcast app. And before you sign off, please remember this important disclaimer that everything in the podcast is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. But if you enjoyed the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this as well. Until next time, thank you for listening.